Okay. Good morning. This is the Senate Health and Welfare Committee meeting. It is March 29th. And we're taking some time to look at S204 and a possible amendment to S204. We wanted to hear from folks, you folks who are here with us, and get your input on maybe what you're thinking about the amendment or the underlying bill. And so we will just go ahead and do that. And I have the order I have is Devin Green and Robin Lunge and Lori Foster, and was certainly happy to listen to your testimony. And then if needed, we'll have some questions and perhaps some conversation. So why don't we start with Devin Green? Thanks for being here.
Thank you for having me, Devin Green from the Vermont Association of Hospitals and Health Systems. I want to just start off by saying that we do support licensing freestanding birth centers, and we support their work. We also support the underlying bill. We support the bill that was passed out by this committee. We think that strikes a nice balance. Our concerns are with the current amendment in front of us today. As you heard in previous testimony, birth centers are not the same as doctor's offices. They require a relationship with a nearby hospital should the patient need or want an epidural, an induction or augmentation of labor, treatment measures for meconium in the amniotic fluid, continuous electronic monitoring, or if they need blood pressure lowering medications in labor. So there does need to be this relationship with a nearby hospital should things go wrong. And we think that in order to ensure both the survival of the hospital birthing unit so that it's there for the freestanding birth facility, a CON process is the appropriate process for this effort. This amendment presented here creates a whole new process on top of the current CON process. It carves out the birth centers and it sets a precedent to carve out other services in the future. It raised a lot of questions for me, such as what are we going to look at when we look at need? Will it take into account what is needed to maintain the skill set of all the healthcare workers at both facilities? Will it take into account the EMT services that are needed in that area, and whether or not there are enough EMT services to move the patient from the freestanding birth center to the hospital? Because we've noticed that EMT services have been struggling in addition to our other healthcare providers lately. And then how many freestanding birth centers can come into an area of need? I know we wouldn't anticipate more than one, but this leaves open the question of potentially 20 birth centers could come in before 2026. It's not addressed in this amendment how that would work. And I know that there are market forces involved, but again, it leaves that open to potential bad consequences. And then what if a hospital's financial situation changes prior to 2026? We've seen a lot of volatility when it comes to our financial standing and our healthcare workforce. And so what do we do there if prior to 2026 something changes? Again, this is why we think that it makes a lot of sense to have a certificate of need process. That process is rooted in the HRAP, the Health Resources Allocation Plan. The decision is based on that plan. And it can provide a targeted look to ensure that both the hospital birthing center and the freestanding birth center can both survive and serve Vermonters with quality care. Thank you.
All right, thank you. We don't, somebody is unmuted. Okay. No, thank you. And I think we have testimony from you previously. I don't know if it was as expansive, but if you have something short in writing, that would be very helpful.
Yes, I'll submit that.
All right, thank you. Okay, so unless there are questions, specific questions, go ahead, Senator Hardy.
Thank you, Madam Chair. Thank you, Devin. You mentioned that you're supportive of the bill as it passed out of committee. Could you be more specific about, maybe you were, and I'm sorry if I'm repeating, but in the bill as passed out of committee, there was the HRAP needs assessment portion of the program. There is also in the amendment, it's just there are other provisions that are embedded within the HRAP. So it's not the HRAP that you're opposed to, it's the other things that were added into the amendment.
I think our highest level of concern is saying that any birth center can come in prior to 2026 into an area of need, right? I think that provides years potentially of any birth center coming in with no look at what that would do to the financial landscape, except for this one look initially, and not taking into consideration changing circumstances. I think ideally, we would not have a special, I think in S285, you are considering the needs of communities, and birth centers are potentially a part of that. I don't think we need to have the HRAP analysis of them, but if that is what the committee would like to do going forward, I'm less concerned about doing an HRAP analysis than I am about this idea of then allowing any amount of birth centers to come in before 2026.
Okay, thank you.
Okay, anything else? Okay, very good. Good clarification. Let's move on to Robin Lunge. Thanks for being here, Robin.
Sure. Thanks for having me. Robin Lunge, Green Mountain Care Board. So the board typically doesn't take positions on bills, so we're neutral, specifically on the bill and the amendment, but I'm here to provide you with information and answer questions. We're happy to take whatever approach the committee would like us to take on this issue. We certainly are happy to do the HRAP analysis. In terms of the amendment, in section 5, you've added some additional parties. We try to be inclusive in our processes, so that works. We would anticipate including other additional interested parties as well, if there were some, even if they're not listed. We do specifically need the subject matter experts from the Department of Health, among others, to make sure that we have that input. In section 5A, I think there are some pros and cons to this approach. I would say the pros to the approach is that it certainly provides for an easier process pending the report and the deadline. I think that the HRAP process could do a good job of looking broadly at the issue of need on a statewide basis. To Devin's point, need is not specifically defined, so we would look at that most likely in a fairly broad way, although it would depend on data availability. So for example, when we're looking at need, we often look at capacity issues in the area, which would require understanding the capacity that exists in the area, as well as the new capacity potentially that would be coming in, quality, price. So that would be something that I think we'd more further define in the process. On the con side, you do lose any specific considerations of a specific project. So the HRAP is meant to take a broad look. The CON process is meant to take a specific look at a specific project. So you would lose an analysis regarding, for example, we look at whether there's public transportation available to the proposed facility. If there's a health information involved, we would look at whether that's consistent with the HIT plan. We look at healthcare reform integration and how the facility is proposing to be integrated into the community and the system, as well as the financial viability of a specific proposals. None of those are things that you can look at the broad level. That requires a specific proposal and is most appropriate in CON. So really, that's all I just wanted to go over is some, pros and cons from our perspective for your consideration, and then happy to answer any questions you have about the processes.
Thank you, Robin. That's very helpful. What I think we might do is hold questions for you after we've heard from Lori, because yours is more about the process and so on. I think so let's do that. And we'll move to Lori Foster, and thank you for being here, Lori. And why don't you go right ahead with your testimony?
Okay, I'm Lori Foster. I am the Legislative Liaison Vice President for the Vermont ACM affiliate. And thank you for taking my testimony and giving this bill such consideration time. We really do appreciate it. I'd like to say that our working group really would like to see this bill pass to the Senate, and we still maintain what I think is a well-documented and substantiated position that the CON process shouldn't be required, but we also acknowledge that some form of it is going to be part of this bill for the bill to be passed. So our main idea at this point is we would really like the bill to be passed. I want to speak a little bit to this question of need. We know that Vermonters want birth centers, and this is some information that I don't know was specifically given in the original testimony, but we know that each month Vermonters go to both Massachusetts and New Hampshire to have their babies in birth centers. And I have spoken with the midwife owners and directors of 3 birth centers, one in Northampton, Massachusetts, one in Keene, New Hampshire, and one in Lebanon, New Hampshire. And what they've told me is that at least 2 to 3 Vermont families from Southern Vermont go to the birth center in Massachusetts, in Northampton, Massachusetts. The similar number go to the birth center in Keene, and about 25% of the clientele at the birth center in Lebanon are Vermonters, and they come from all over central and northern Vermont, including Chittenden County. And she had a list of the various towns they had come from, and they included Winooski, Shelburne, Essex Junction. So, I mean, I think we have to ask ourselves, why are families willing to drive over an hour and a half to have their babies outside of their community? They do that because they really feel strongly about the advantages of this service for their family. And we have elucidated those, advantages for birth centers: lower C-section rates, lower morbidity for moms, more continuity of care. But we do see Vermonters leaving the state to have their babies at birth centers. So I think that clearly says there's a strong need here. There seems to be a little question about who's promoting the bill. I mean, it's definitely, we're a core group of midwives and citizens. This is not the first time that there's been an effort to license birth centers. You may all be clearly aware of that. There's been a number of times since the early 1990s that efforts have been made. This particular one started in 2018 and ended up with a study that was done by the Agency of Human Services that recommended that freestanding birth centers have a distinct pathway, and that was based on the standards of the AABC, which is the American Association of Birth Centers. There's really, really widespread support. So again, in terms of the need, we have the American College of Obstetricians and Gynecologists saying that birth centers should be part of maternity care services in all regions, and also the Society for Maternal and Fetal Medicine. I want to just really briefly read something that was in the testimony of Dr. Fisher. It'll be quick, but again, trying to address this question of why do we have Vermonters going out of state for this service? So if you remember, Dr. Fisher he's an expert in the field of maternity care services. He's an OBGYN physician at Dartmouth Hitchcock, and he's the medical director of Northern New England Quality Improvement Network. And he said, the sum of my professional experiences has reinforced time and time again the vital and necessary role that birth centers play in the continuum of care for pregnant and postpartum people across the region. The highly trained specialists and subspecialists who work in hospital-based L&D units are caring for increasingly complex patient population who require a level of resources that are simply not necessary for the vast majority of healthy people experiencing the physiological process of pregnancy, labor, and delivery. Placing these patients in a high acuity and resource-intensive clinical environment exposes them to unnecessary interventions that result in poor outcomes, including higher rates of C-section and perineal trauma. As a public health intervention and a means of responsible stewardship for our precious healthcare resources, I strongly encourage you to approve this piece of legislation with all its provisions, a clear path for developing licensing, establishing coverage services under health insurance plans, and that it would be without an onerous certificate of need review. So the last thing I just want to say is I think the idea that birthing centers are going to put hospitals out of business is not well founded. I think Devin's point, is really good, and we all know this. It's like you can't have a birthing center that is a great distance from a hospital with maternity care services. Birthing centers need to have that as a backup, because we know there's going to be a certain percentage of women that will be moved to the hospital. The good news about that is the majority of them are not emergent reasons. They're things like, as you mentioned, Devin, the meconium and the, amniotic fluid, or perhaps someone's blood pressure goes up. Generally, it's rare that it's an emergency, but it's a reasonable thing to, go to a hospital when those things occur, and we know that they will. And that's why we have the rules and regs and protocols for when we would do that. But if I'd like to just give a brief example. If someone opened a birth center in Southern Vermont, let's just say, so we heard from Dr. McGraw in the original testimony that she was super concerned that would put, Brattleboro Hospital at risk. However, what we know is a small birthing center is going to probably attend, 5 or 6 births a month. Let's say 6. 2 or 3 of those are going to be these people that go out of state, because if they have a birthing center in their backyard, they're going to go to that one. 2 or 3 of them are going to be people that might have otherwise had home births. And so you might take away from the hospital population a couple of families a month. I think it's unlikely that that's going to put the hospital out of business, especially when we know maternity services aren't money makers. At the same time, it's going to bring in the ancillary services that those other people are going to need, the labs, the ultrasounds, the consults, et cetera. So I find the argument that we're going to put hospitals out of business to be, not substantiated, and also sort of counter to even what a birth center would need and want in order to exist. So I just want to make that clear. In terms of the bill as it was passed and the Hardy Amendment, I think we have a
Okay.
what's that?
It's an unknown sponsor amendment.
I'm sorry. Sorry.
That's okay.
Okay, we would probably prefer the newer amendment. But again, our main hope at this point is that the bill will be passed out of the Senate, and so we will respect which your committee feels is the better option.
Okay, thank you. Senator Cummings has a question.
Okay. My concern is, given the low birth rate and the low number of births, we've been told that we've already had one hospital close its obstetrics unit. So there's no options there right now for anyone, a birthing center or anything. Devin, are you saying that the hospitals aren't concerned that birthing centers, because we also had testimony saying you have to keep an OBGYN team on call 24/7, 365. Are the hospitals concerned or not concerned that the loss of 4 or 5 births could put them over? I think that's what we're struggling with.
Yeah, and I would say, so I would say we are very concerned about that. And I think it's not just about a loss of revenue, it's a loss of skill set as well. So we live in a rural state. We have the lowest birth rate in the nation. If you're doing like an orthopedic surgery that is scheduled, we can share that surgeon, we can move them around the state. There's flexibility in that. There's not flexibility in terms of the healthcare workers who are staffing our birthing units. They need to be there 24/7, and they also need to maintain their skill set to provide that quality care. So I think there's something to be said for the idea of bringing more births back to Vermont through freestanding birth centers. I'm certainly very open to that. What we would like is a process that examines that further to ensure that we don't create any unintended outcomes or any further closures of birthing units at hospitals. And we think the CON process is the appropriate way to do that.
Okay, thank you. Any questions now for Robin or Devin or Lori? I think, we've heard testimony on this, and now I'm hearing, what I'm hearing are the pros and cons of the amendment. Loss of specificity is the one that was most concerning, I think, to me. And then I'm also hearing from Lori that you are leaving it to the committee for a committee decision, that your interest is to ensure that the bill moves along. I think our committee wants the bill to move along. So I think we've heard everything that is essential to our decision making. Are there any other questions for folks? Yeah, go ahead, Senator Hurd.
I have two questions, one for Lori and one for Devin, I guess, probably Devin. Lori, you went over the sort of benefits of birth centers again, and nobody on this committee is disputing that, nobody. So I hope that you understand that, and I don't think any of our witnesses ever disputed that either. What we're trying to do is strike a balance, and I would be, while I heard you say, leave it to the committee, we're struggling clearly because we've had this bill way longer than any other bill in our committee. Kind of strangely, it does feel similar to the birthing process, frankly. It's really kind of painful, and I just want to yell. So
let's make it premature.
I know that you don't want to have a CON process, that the amendment, which was I was working with other people to try to come up with some kind of middle ground or compromise, whatever. So it's not really my amendment, but it was something that I worked on behalf of the whole committee. So I'm wondering what process would, short of no process and just sort of doing, going ahead right away. Clearly it seems to me that there's got to be some process or some way to compromise. So what would you recommend? What would be acceptable to you and your group?
You're muted, Lori.
You're muted.
Okay, sorry, yes. I think that one thing that that we like about the new amendment is that specifically midwives are involved in the process. So that's, I think, a positive thing. I think that it also potentially gives a clear, not a clear pathway, but a less obstructive pathway if the study group, or what are we calling? I'm sorry. If the process identifies an area that has a need, then a person opening a birth center would not then have to go through the CON. I don't think that there's really any concern, quite honestly, that 20 birth centers are going to come into an area, or even more than one. You see New Hampshire, where they've had birth centers for decades. They have 5, functioning birth centers, and they have a population that's bigger than Vermont. So my guess would be that there wouldn't even be 5, maybe there would be 3 in the state. But, again, you see people traveling a long way to get to birth centers outside of the state. The opposite can obviously happen. We can have people coming across the border from northern Massachusetts if there's a southern Vermont birth center, or people coming across from New York to Burlington. We don't know, we don't know what that'll look like.
Lori,
I'm sorry, that was a little off
No,
topic.
We're hearing you and we understand the issues that you've presented to us. We greatly appreciate that. I'm looking at our clock and I think what we're going to do is allow for the committee to have a short discussion and then we can make a decision. What I'm hearing are two sides of the story. The hospital's not favoring the underlying bill, and Laura, your interest in having the amendment go forward. But overall, I think we're all in agreement that we need to see the licensure and the birth centers move forward in the state. And I think I've captured that. So
Can I ask a question?
one more question.
Okay. So Devin, an alternative that several people have proposed to me or mentioned to me is to have similar to what's in the amendment, but have it based on type of hospital, so that there could be there would be a CON or no birthing centers in certain areas of the state with, I don't know, and this is my question, is like the different levels of hospitals. Can you explain what those levels are and whether you think that makes any sense? And I know I'm just springing this on you, but several people have proposed this to me, and so I'm trying to figure out if that's even viable or whatever.
Yeah, I will quickly explain the levels of hospitals. We have about half of our hospitals are critical access hospitals, so those are 25 beds or fewer. And then there's the sort of community hospital, which we think of as the more traditional hospital. That's like Rutland Regional Medical Center. And then there's our academic medical center with the UVM Medical Center. So that's a quick and dirty on the levels of hospitals. I think given how few births we have in Vermont, if we had more births in Vermont, I think I'd be more open to that sort of process. But given that we have so few births, and I think a lot would depend on where the hospital is located. Is it on a border? Is it not on a border? I don't know if it's as easy as delineating between type of hospital. So again, would prefer the bill as passed by the committee.
Okay, thank you.
Okay, good, thank you. Yeah, we're past our time, and so I was hoping that we could get to some resolution on this morning. I like the underlying bill. I think it's a way to move forward, and I think it gives the concept of the HRAP also gives the House Committee on Health and Welfare an opportunity to think further. So I think this is just the beginning. I do respect the concept of having an HRAP, but to have us put the process in place in committee, it probably makes sense for the Green Mountain Care Board and others to have that debate and to look at how best to build a birthing center process. So that's where I am with this. But I'm open to you guys, and so you want to take a minute?
I like the original bill.
Okay, that was
Is that what you
happening.
just said?
I said I like the underlying bill better at this point,
Okay.
just for a whole lot of different reasons.
Well, I said I'd support the compromise and that order to,
I'm sorry to hear you.
I said I would support the compromise in order to quell the mutiny.
Okay.
So, and I appreciate the attempt at the compromise. I think it may be a cleaner process to just go with the underlying bill as it came out of committee, since we all worked for it.
Okay. You want to weigh in, Senator Hardy, or not?
I'm really torn. This
Yeah, of
whole
course
thing
you
has
are.
like made me super confused, frankly.
Well, you're also on two committees.
I know, and so I think
I
I'm
know.
kind of with Senator Cummings just because we tried to quell the mutiny in the other committee and presented this amendment as a possible way of doing that. I don't love the amendment. I think it makes it more complicated, but I also you know, it was something to try to, you know,
Right, and we understand that.
yeah.
Okay,
We
so
tried and we lost.
here's what I'm gonna suggest. I'm gonna suggest that we reserve a teeny bit of time tomorrow morning to make our final decision. We're not on the floor until 1 o'clock tomorrow afternoon. And Aaron will carve it out, we'll either carve it out in the time that we currently have, and we'll add a little committee discussion on 204. I think we'll do that, and then if necessary, we'll do it at 8:30 in the morning, but I'm not advocating for that. So I can see everybody's thrilled with that.
We
So-
can also, just
Yeah,
Senator
so-
Cummings and I can offer that amendment, and then
Pardon me?
it's, amendment could just come from.
Should stay.
Yeah,
Oh,
so,
okay.
so we're gonna have a discussion tomorrow. We'll make our decision. What comes out, right now, we have 3 people. Right now, we have 3 people supporting the underlying bill. So, I mean, but I don't wanna cut off discussion at this point, so we'll come back to this.